Hi everyone, my name is Professor Chloe Orkin. I'm a doctor and a researcher in London and former chair of the British HIV Association. My focus is on health equity and new HIV treatments. In other words, making sure that everyone has access to new treatments and innovations. So, together with a wonderful steering group of people living with HIV in 17 European countries, we've designed a study called Ask Us Europe. Our aim is to find out more about people's experiences during their medical consultations. Are healthcare providers discussing options to modernize HIV treatments to simpler tablets or to the new 2-monthly injectable treatment called cabotegravir and rilpivirine? Thinking about injectable treatment, studies tell us that people who do go on to the injections really like them. But we also know that less than 2% of people living in Europe are actually on the injectables. So we want to understand why there is this big difference between people's interest in injectables and what's actually happening in clinics. So far, more than 1,000 people across 17 countries in Europe have answered our survey. And we'll be sharing some initial findings during the EACTS conference on the first 600 participants. We know that people living with HIV are asked to fill in loads and loads of surveys, and they often don't find out what the results are or see any clear benefit to participating. But we believe that our research approach is different. We really want this study to be directly useful to the people who participate in every country. So let me tell you more about what we're going to do with the data. In addition to providing the overall results, as we are doing at EACTS, we will also provide a report to the community activist organisations like THT5 and to the doctors who are collaborating with us in each country. This report could help community organisations to plan their support activities. The report will also help doctors, nurses and pharmacists to understand people's perceptions of their medical consultations. But we can only do this if we have enough participants to get a readout. About 100 participants per country would be a minimum. So far in France, we only have 30 participants. So we're asking you all to please fill in the survey. Also, we don't have enough responses from cis women, transgender people, from minoritized ethnic groups, older people, and recent migrants. So we especially encourage these groups to respond. It's important to say the survey is anonymous. Because inclusivity is so important to us, we've translated the survey into 18 languages, including French and European languages, and also into Ukrainian, Turkish, Arabic, Russian, and Kiswahili to make sure that everyone has the opportunity to participate. To find your language, just click the box on the right of the front screen where it says English, and you can choose your language. I really hope that you'll feel that this survey is worth your time and feel motivated to participate. We believe it will help improve HIV care in Europe. Thank you so much for listening.